So how did I get my COPD, and what are some triggers that may make it worse?
Smoking is the number one cause of COPD, so smoking cessation will greatly reduce your risk factors of making the COPD worse. Every patient is different, and so it's important to identify your triggers with your doctor to help reduce your COPD exacerbations.
What stage is my COPD?
According to the Global Initiative for Chronic Obstructive Lung Diseases, there are 4 stages of COPD. Make sure that you ask your doctor what your FEV1 percentage is and what your pulmonary function test results are to help determine your stage of COPD.
Am I using my medications correctly?
Medications are very important in the management of your COPD. Make sure that you bring all of your inhalers to each office visit and demonstrate using your inhalers to your healthcare provider. That way they can give you tips and tricks on making sure that you're using them properly. Also make sure that you know which ones are your maintenance or daily inhalers and which ones are your rescue inhalers. And if a nebulizer has been prescribed to you, make sure that you know how to use that properly as well.
What are some signs that my COPD is getting worse, and what should I do if I start to feel worse?
Talk to your doctor or mid-level provider about creating an action plan for when you feel that your COPD symptoms are getting worse. Make sure that you know what stage COPD you're in, what your FEV1 percentage is at baseline, and what medications to use if you feel that your symptoms are starting to worsen. Treating things quickly can actually help prevent you from being in the hospital.
What else can I do to improve my quality of life and my lung health?
In addition to using your inhalers, there are several other things that we need to do to treat your COPD. One of those is lung cancer screening as well as sleep apnea screening to make sure that you haven't developed any secondary lung conditions. We can also do lung strengthening exercises with pulmonary rehab, and if you're still smoking, you need to stop. Smoking is the number one cause of COPD. Exposure to other inhaled chemicals or pollutants is also a risk. Ask your provider about what caused your COPD and ways to avoid further damage, such as smoking cessation and wearing a mask to avoid other irritants.
There are 4 stages of COPD. Make sure to ask your pulmonologist what stage COPD you have. Ask what your FEV1 percentage is and what you can do to improve your numbers.
Ask your provider which inhaled medications you should use every day and which ones you should use as needed. Bring your inhalers to each visit and demonstrate how you use them to make sure you're using them properly.
Ask your provider about creating an action plan to manage your COPD if it becomes uncontrolled. This includes monitoring your oxygen level with a pulse oximeter and knowing what medications to use in times of exacerbation. You may be able to prevent visits to the emergency room and hospitalizations by identifying warning symptoms early.
Ask your provider about pulmonary rehabilitation, where you will learn breathing exercises to help strengthen your lungs and increase lung capacity. Ask about devices such as the flutter valve, incentive spirometer, and nebulizer. Ask about screening for lung cancer, sleep apnea, and other secondary lung conditions that could make your COPD worse.
Remember, smoking is the number one cause of COPD.
It's never too late to quit.